My name is John France. I'm the head athletic trainer at East Carter High School. We are responsible for preventing, treating, and rehabbing athletic injuries of all ages. We're the first line, for any injuries. We are the first responders for injuries. I had known for several months that I'd had some shoulder issues. It was getting to the point where it was affecting sleep, it was affecting my job, being able to lift the equipment, carry it around, and so I decided that it was time to get it checked out.
He had a partial thickness tear of his rotator cuff and a slap tear, which is a tear of the labrum where the bicep tendon attaches inside the shoulder.
I met with Dr. Chambers. We talked about the issues that I was having. He did his evaluation, and come to find out we agreed on what was wrong, and so he set me up for some advanced imaging, some MRIs, and once we had that back, then we decided that it was time to move forward with surgery and get it fixed.
In his case, we had him in a beach chair position, so he's kind of sitting up during his surgery while he's asleep. After that, he gets prepped and draped, then you put in the scope in from posteriorly, and you from the back, and you look around the shoulder and see what pathology you find. And then after that, you make your portal in the front, so then you have a portal you can work from. Lucky for John, he only had a partial thickness tear of his rotator cuff, so we were able just to debride that, clean it up a little bit, so he did not have to have a repair. So recovery is a little quicker without having to have a repair of your rotator cuff.
My surgery went well. I didn't have any issues at all. I like to joke that it was like somebody turned the light switch off and turned it back on, and it was over, because that's exactly what happened. Woke up from surgery, went home that day. I don't have near as much pain already, even before the physical therapy, to get the strength back that I need and the range of motion back that I need. I'm able to sleep better, able to do my job better already, and like I said, I'm not back to full strength yet.
Saw John at 2 weeks after his surgery. He actually called me and wanted me to let him go back to work before then. So he's been doing pretty good. He's back to doing his athletic training. He's still a little limited because he's early. He can't really lift a whole lot just to protect that bicep tendon. But he's back to doing almost everything.
I put mine off for months, and I wish I hadn't. I mean, it affected not only my job, it affected my home life too. The kids, wanting to go do stuff and wanting to get out in the yard and play, and I just couldn't play the way I needed to with them. If you've got an issue that's affecting your family life, your home life, your work life, get it fixed now. I mean, there's no sense in waiting, and just because you're having the pain doesn't mean that it's surgery related. It doesn't mean you have to have surgery to fix it. There's several other options, get you more pain-free and get you where you need to be able to do what you want to do.